External ventricular monitoring, or EVD. If a patient has a brain injury, head injury, a mass, they could have an increase in ICP, inappropriate accumulation of cerebral spinal fluid, and they may need to place a drain and pull some of that excess fluid off. Some nursing implications with a patient with an EVD. It's a closed system. It's a direct line to their ventricles and their brain, so you want to avoid contamination and infection. You use strict aseptic technique when handling it, and sterile technique with 2 RNs when you change the collection bag. We'll go over that. You inspect the insertion site for signs of infection. It's typically the line enters their head at the top. You see the line stapled to their skin at the top of their head with a tegaderm over it. You want to check to make sure that that is intact and stays intact. None of the staples are pulled. Check all connections for leak. Make sure the transducer is always level to the external auditory canal while the drain is open to the patient. Place a sign over the bed stating to speak to the RN prior to adjusting the patient or bed. You don't want somebody coming in there raising the bed or moving the patient while the drain's open. You also inspect the tubing for kinks in order to prevent that. You're going to chart this under neurodrain assessment and drains and tubes. So here we have an external ventricular drain. You want to make sure the setup is correct. So we have multiple scales here. Right now we have it on millimeters of mercury. So the physician has ordered 10 millimeters of mercury. You have ventricular, this is a ventricular drain and a lumbar drain. So we have ventricular centimeters of water, but this scale looks different. So if the order says centimeters of water, if it says 10 centimeters of water, but the nurse has it on millimeters of mercury, look where it actually is on 10 centimeters of water. So it's supposed to be down here, but it's not. And then your lumbar drains are, this is millimeters of mercury lumbar, centimeters of water lumbar. So mostly we see millimeters of mercury ventricular. Also, this whole thing, it'll come up to you from OR all put together typically, but this is a place if it's a ventricular drain, and this is where you place it if it's a lumbar drain. And it just pinches, these two plastic pieces pinch, and it just snaps in there like that. So that's something else that you could confirm. So you want to confirm your orders. Make sure that this level is leveled with the external auditory canal or tragus of the ear. And how you level that is you use this laser level that is attached to the transducer on the back side of it. So if we take a closer look at this laser level, we will see the bubble, we'll see the laser, and we will see the button to activate the laser. So I am going to make sure the bubble's in the center. I'm going to press the laser button to activate it. And then I'm going to unscrew from the pole and lower or raise this entire system to make sure it's level with the external auditory canal. I moved my head, not the thing. But. So if you adjust this, you're adjusting how much is being drained off. If it's set up here, you're not draining off anything. If you're set down here, it's draining a lot more off. Picture a pond that has a drain with a tubing that comes up from the bottom to the surface. So if you raise that drain tubing of the pond, you raise that tubing up from the surface of the pond, now it's going to accept all the rainwater and it's going to get deeper. If you lower the drain into the water a couple feet, now all of the water from the pond is going to pour into there. You're going to have less water. It's going to be shallower. So when you're doing this, you're making the pond shallow. When you're doing this, you're making the pond deeper, pond being the skull and the fluid in the skull. So next we want to, and we're going to do this every hour. So we make sure it's on with the patient, onto the patient here. We're going to make sure it's leveled. The transducer is leveled with the external auditory canal. We're going to check that the drip chamber where it exits is dripping. If it's not dripping, it could be occluded, and a way to test this is briefly lower it and bring it right back up. If you don't see dripping, if you see dripping, resume, fine, bring it back up, it's great. If you don't, it's probably occluded and might need flushed by the neurosurgeon, so call the neurosurgeon. You want to check for color and clarity. So it should come up to you from surgery bloody or pink tinged and become over time straw colored or clear. If it goes from straw colored or clear to pink tinged or bloody, then it may have migrated out, and so you would call the neurosurgeon in that case. Every hour you're going to assess the output. So it's going to drip down into the bottom of this drip chamber, and then every hour you're going to calculate that. So say they had 5 out this hour, then you're going to turn the drip chamber onto the collection bag to drain that drip chamber and turn it back off. Once you get to the point that this collection bag is 2/3 full, then it needs changed. So how you go about changing that is you need 2 RNs. So this is a sterile procedure. So I have I'm gonna glove up here. I have my gloves. Now I'm gonna grab my ChlorPrep. I'm gonna ChlorPrep this entire connection point, even on the back side where the blue is. I'm gonna ChlorPrep as much as I possibly humanly can. I'm gonna ChlorPrep the top part of the bag, the connection points, back here. Be aggressive. Be aggressive. Now I have my sterile gloves, and I have my my sterile bag that I'm gonna change out to. So those are located below the AccuChecks on the west side in critical care. So I'm gonna sterilely glove up. Now I'm going to unscrew this connection points. Now it's unscrewed. I'm going to take it off of the tabs and remove it, maybe. It's really in there good, so this is why you want to, it's probably never been taken off. Okay, there we go. So now we have it off. Now I would hand this to the other RN or staff member. They're going to grab it. I'm not going to grab it. Now I'm going to grab my new replacement bag that I had opened and ready, and I'm going to connect it, reattach to these blue tabs, and I'm ready to go. So if you're transporting the patient, this has a filter that is open in the top. So you don't want to place it upside down. You want to keep it at an upward angle. So you're going to place it on the patient's chest, such as this, in the bed. It can be like this. It just can't be flat or upside down. Another thing to note is a lot of nurses will clamp in different places. So there's a few different places you can clamp off to the patient when you're doing so. One is here, closest to the patient, which is a CSF sampling port. I recommend keeping this open and not clamping here. You are going to be assessing your color and clarity, your drip, your output, your leveling, all here every hour. So this is where you need to turn off to the patient and turn back onto the drain. If we're going to different places, this could be tucked under a pillow or pillowcase or blanket. The nurse might not think to look there. We've had mistakes. So leave this onto the patient. You can clamp off to here. That is perfectly fine. We should always clamp off here because this is right at where we're looking. You'll never draw sampling of fluid. Only the neurosurgeon can draw CSF up from the patient using the external ventricular drain. You never flush through the line. Other things to note are to always lock the drain whenever you're repositioning the patient, moving the patient, turn it off to the patient here. Anytime you're moving the patient, adjusting the bed, bathing them, you'll turn it off to the patient. And then make sure their head is midline or stays midline as possible. And this will help with drainage. Always lock the drain whenever you're repositioning the patient, moving the patient, turn it off to the patient here. Anytime you're moving the patient, adjusting the bed, bathing them, you'll turn it off to the patient. And then make sure their head is midline or stays midline as possible. And this will help with drainage.